Because the problem with the tendon is that it's not like a muscle where I tear a muscle, it's an obvious tear, there's blood into it, there's a bruising element to it. You let it rest, you slowly add weight to it, and then it overall will just get better. Obviously, if you're a sprinter or something like that, it changes things. But when it comes to a tendon, it's a little bit different. It's not that just the tendon is torn or that the tendon is swollen. There's a lot more complicated actions that are happening. And in green here, we have some tendons. So we have the patellar tendon and we have the Achilles tendon. And then the brown is the muscles. And what you'll see a lot with tendons is that they're not just really one layer. They're actually a bunch of bundles all connected together. So if you imagine the muscle is actually a whole bunch of different fibers that are all bundled together. And then each one of those bundles are then bundled with more bundles, and then it just keeps going until the full muscle is formed. And all these bundles, they're all wrapped in this layer of fascia or connective tissue. And as they all coalesce near the bottom, all those layers actually all intertwine together and then form what we call the tendon. And then the tendon connects into the bone. Now, each one of those bundles actually operate on their own. So they're not like, now that they're all together, they're now just one unit. They're still individual bundles. So if we see here, the original thought of a tendon is that a tendonitis or a swelling of a tendon is that this whole tendon here, so imagine I cut, just put a little dotted line there. I'm cutting through the tendon this way. So we're looking kind of bird's eye view through it. The idea originally was that this whole thing was irritated and the whole thing was swollen. So then the thought was, if we just take away the swelling, give you some anti-inflammatories, problem solved, but rarely has that ever worked. And the problem is that it's not that this is just swollen, is that the body will actually protect it. And this is what's called reactive tendonitis. So when I first hurt my tendon, so say I did a really good lift, but I pushed myself really hard and then I started to feel a little bit in my knee. This part here started to get a little bit inflamed on the outer side. And I was like, okay, I worked out, it was kind of hard, but I didn't really hurt myself, so I'll keep loading it. The problem is that when this reactive tendon keeps getting loaded, it's trying to protect itself and it's like, no, I want you to stop, but you keep loading it. So then it gets worse and worse until the point that that whole reactive element now swells up and causes pain, and then sometimes will even start tearing. Now that's the simple view because I'm just looking at the tendon as a whole. But realistically, what can happen is that inside of this tendon, you can have another bundle, but you can also have multiple bundles within that tendon. And this is where it gets tricky, because say I worked out really hard, it got reactive. Now, instead of pushing through it, I just let it rest, gave it enough time, it stopped being irritated, then I can go back. Or I pushed through it, it still got irritated, but instead of the whole thing just being a full swelling, it was actually more just this bundle here that was irritated. So this bundle keeps getting swollen. And then what we get is this chronic pain and tearing of this one area, and this area is the problem. So to heal this, unfortunately, though, all of it's still working together, so we need to get this guy to work better. So the drills that we use, this is where it gets complicated. Before we would do eccentric drills, which is a lengthening of a muscle or tendon while it's under load. And eccentrics were shown to really help with tendon pain. Unfortunately, if you have one of these bundles that are still swollen and irritated, the eccentrics put a lot of load into it and essentially just gets it really mad, and then it just gets madder and madder, and then it takes on more pain and takes on more of the area, and then this next bundle will get irritated. So when we have that tendon issue, we can't just simply load it up, do the rehab of just eccentric loading, because if this is still irritated, that's going to keep being a problem, even though all the rest of this doesn't have irritation and it can handle the eccentric loading. So the key is we can use pain as a guide. So instead of loading up this tendon that was irritated when it first happened, we can use something called isometrics. So isometrics is contraction without movement. So if I can contract this muscle without movement, we don't inflame the tendon any further. And so it's a safe way to fire up that tendon without pissing it off. And we should be able to get it to calm down to the point where we can then load it appropriately. So once that tendon is calm, so once we get a tendon that isn't inflamed and the bundles themselves are irritated and they're all fine, this is when you can do eccentrics and there won't be any extra problems.